So first of all, we see country by country that the awareness levels of the populations are really low when it comes to alcohol and cancer link. Maybe tell first, what did you find from the survey that you commissioned? How is the situation with Swedes?
Well, we are absolutely no better than other countries, and we were kind of aware of that. So earlier sort of reports have indicated the same things, that the awareness is low, and this survey was among, a random sample of the general public. But we also know from, because, I'm a researcher and a cancer nurse, and I've been working with cancer all my life. And I know that there's also a lack of knowledge among the professions working with cancer. So we wanted to see what the general public's view were, and in this way with the survey, which is anonymous, etc. And we found that, 8 out of 10, the survey is based on 4,500 people, and 8 out of 10 knew that there was a link between cancer and any type or any consumption of alcohol, sort of large, but people thought that it had to be a lot of alcohol to be impacting cancer. And when we also asked about moderate consumption or low consumption, it was only 1 to 5, 1 of 5 that thought it could be a link. So most people, by far, most people did not know about that. We have a problem also that the professions are, it's a sensitive question. It's not only about knowledge. We find that it's difficult to get the research. There is quite a lot of research showing that alcohol or ethanol is a cancer-causing substance, but people don't want to believe it in a way. As I said, I've been working with cancer all my life, and I saw similar things when we started talking first about smoking, 20 plus years ago with cancer patients. Oh, we shouldn't. And the same when it came research results from physical activity and cancer, showing the benefits of being physically active. A lot of the profession didn't really want to deal with this because you should leave people alone and they should live their own life, etc., etc. And here we see the same thing about alcohol, but maybe even stronger. I think it's to do with, a lot of the general public consume alcohol and they feel it gets too personal in a weird kind of way. I think my belief is that you need to have two thoughts awake at the same time, because you need to inform people about the truth and what the results, the evidence that we have. And then it's up to everyone to decide what they want to do with that information. But to keeping this information away from the general public is totally unacceptable, if you ask me. And we also asked in this, which was probably the most important question, if you knew that low or moderate consumption of alcohol would impact the cancer risk, would you change your behavior? And nearly half said yes. And they gave examples of, well, maybe I should think about not offering alcohol in every social event, or thinking about not just consuming alcohol as a part of daily life, so that was kind of reassuring for us that actually if people knew, they probably would change behavior. Then of course that tells us that we need to communicate about these kind of things much more than we have done.
You mentioned that it's unacceptable to keep this information from people. What do you think? What are the main ways to get across this message? What the states should do? What the governments, the health institutions, the cancer societies?
Yeah, Well, we kind of asked the general public that as well, and they said, well, first of all, the most trusted sources of information was researchers, healthcare staff, and also authorities. So they said, start already in the schools, inform people in the kids in school, so they know already. And also they talked about labeling, warning signs like we have on tobacco. And also they say about on a societal level, you need to be more active. The society or the authorities need to be more active in informing people about this. So it was actually both on a sort of personal, individual level in that you need to share the information, but also on from the healthcare perspective and from the societal level. So it should be easy to choose something else. And I can only agree. It's not the one fix. We need to work with this from different perspectives. But without the information, people will not bother. If the society says something, you need to know why, and you need to make it your own knowledge.
In Sweden, alcohol policy is much stronger than in most of the European countries.
Yeah.
In most countries, alcohol advertising is almost limitless. So we can only imagine the conflict in a way what people are experiencing.
Yeah.
You are, from one hand, you are saying that it's so dangerous, and on the other hand, no limits.
Yeah, exactly. And it's actually changed in Sweden as well. When I was young, there was absolutely no advertising allowed for alcohol. Now it's all over. You can't watch one program on TV without alcohol and glamorizing alcohol, etc. So it's definitely a difficult topic, because I mean, for tobacco is strictly forbidden to advertise, but not alcohol. So we've gone from being quite controlled and restrictive to being much more open in Sweden. And even if we have very strict regulation of where you can buy alcohol, that seems to work quite well, because it's not, you can't go to the supermarket and you can't buy on Sundays or evenings, etc. But still, it's a state-run, the Systembolaget, which is selling alcohol, is owned by the state, but they also have a difficult. They're actually collaborating with us in this campaign, which from people from other countries, they think, how can that work? Because they really actively trying to get people to choose alcohol-free options, or drink less alcohol, or consider that, and they're still selling it. So it's a bit of a double standard, but I guess there's not so many alternatives. The alternative is to forbid alcohol in general. I don't know if anyone thinks that would be possible, but yeah, it's complicated.
One other tool, in a way, that the governments also use is the low-risk drinking guidelines. But there seemed to be a sort of mismatch also. The cancer researchers are saying clearly that there is no safe level.
Yeah.
But again, most countries state that the low-risk country, the level that they are setting is much higher. And part of it, they explain that, as you in the beginning also said, that we can't ask too much, we can't make the bar too high, and so on. So what would your recommendation be to countries regarding the low risk drinking guidelines? Yeah,
well, we had that kind of in the cancer areas as well, and mainly from the US. They actually gave out regulations, but they were, from a Swedish perspective, and I think from most of Europe, they were really high. They were like maximum one equivalent of 1 glass of wine per day if you were a woman, and 2 if you were a man. And they said you cannot collect and drink it all in the weekend, etc. But that was like more than most people actually consume. And if you look at the research from the cancer perspective, if you want to prevent cancer, there's no safe limit. So we don't want to give recommendations, because it also depends on what type of cancer, what type of person, etc., and also what kind of other risk factors for cancer do you have. So to give recommendations, and it's not just me saying that. WHO, who's developed the European Code Against Cancer, says that we can't give recommendations. There is no safe level. It's the same as tobacco. It's obviously less risky to smoke fewer cigarettes per day, but it's not, you're not free of the risk. You can't give a recommendation, because it kind of get people to believe that they could drink on a safe level, when if that's not true, you can't tell people that. But we also say we believe that in the PrEvCan campaign, that you can't point finger and tell people how to live their life. It doesn't work. You need to inform them, and also say, well, it's up to you what you want to do, but here is the information. And that's also we've done in PrEvCan. We have done some research that's submitted for publication, actually, where we have focus groups interview with different groups across Europe that were called sort of vulnerable groups for all cancer risk factors. So it's young people who think they're immortal. It's young people that are cancer survivors themselves separately. And we also have had focus groups with people with immigrant background, because we see that is a problem if you come from another culture with cancer risk factors. And the final group we've looked at is people with learning disabilities or intellectual disabilities. And it's very interesting data. And they tell us that don't point finger, don't give us a list of things we can't do, but do inform us and tell us the benefits of not drinking. You know, so it's but it's such people tend to get very threatened when we talk about this. So it's really yeah, you need to tread very carefully, so you don't come out with this crisis information or crisis communication. And I think that sometimes whatever you do, it's read like it is that you're telling people off, even if you're trying really hard not to do it.
Now, you started with a group of organizations, a new project. Tell a little bit about this project.
Yeah, it's PrEvCan, so cancer prevention across Europe. It's an initiative from the European Oncology Nursing Society, and we have 66 partners across Europe. And I would say it's funny that you say you're from Estonia. The Estonian, there is a couple of Estonian partners that are really active. Professor Kristi Rannus from the university in Tallinn, for instance, she's doing really impressive work, both with the healthcare educations like the nurses and the other professions during their training, and also together with the hospital. So they've been really active. But there is professional organizations across Europe that for physicians, oncologists, nurses, but there's also healthcare organizations, universities, patient organizations, etc. So we are like a consortium of 66 organizations, and we're taking on a campaign for 12 months where we focus on each of the 12 recommendations in the European Code Against Cancer. And try to get it out as much as we can. So we provide from the project toolkits with, you know, scientific evidence recommendations, where we try not to sort of be pointing fingers, but providing information. And we provide that in 25 different languages, free of charge for all the people that are involved in it. And then it's up to all the organizations if they want to use whatever we are producing and disseminate that, or if they want to do their own activities as well as that, etc. So it's very free for everyone involved. And we've decided that everybody can adapt their material to whatever activities they want to do, because we also know, we're very aware of the cultural differences in communicating about public health. What works in Bulgaria might not work on Iceland, etc., etc. So you need to be able to adapt to your own reality in a way, and that's been very successful. We don't have a lot of funding because this is an NGO, and we actually are doing this out of volunteers from all the organizations, and but we are following up, and all the partners are providing activity reports each month. So we will have a large-scale evaluation when we complete the campaign in the end of September. So, but quite a lot of attention from the EU, etc., of course, and they think it's really, really a great campaign. And we do see that we reach out, because we can see that we do reach out to the general public more than we thought we should do. But of course, reaching out with information is not the only solution, but it's what we think is a start. And we also see that our partner organizations really are using the materials and the toolkits we are providing in different ways. So we can't say anything about the effect at the moment because we're in the middle of it, but it looks like we are actually reaching out. And alcohol then was the 6th risk factor, so that was during March. And our campaign in Sweden, there's been a lot of attention, national TVs, newspapers, etc. I was on the morning show on the national TV the week before last, and I've had loads and loads of contacts after that. People want to know more about this, but also controversial. There's a couple of senior professors from the Karolinska Institute that wonder what we're doing, and they really question everything. And how can I say that it's not safe to drink wine? You really are surprised of the negative impact, but in small scale. By most, it's very positive, of course.
Also in Sweden, you have quite a big group of organizations behind you.
Yes, we have, in Sweden, we have 21 healthcare regions that sort of provide all the healthcare, or most of the healthcare, and 8 of them are actively involved in the whole campaign. And then we also have nursing organizations that are involved, and in the alcohol part, actually, we have our board of welfare are behind it. We have the Cancer Society. We have Systembolaget, which sells alcohol. All kinds of organizations have joined for the alcohol part of the campaign, which is really good, of course.
Have any next plans? What do you do with the website also and the campaign overall?
Well, the website are growing more and more. Both, you probably talk about the alcohol website that Swedish organization have done. That is, we're providing more and more information there, and there will be a follow-up there. For instance, there is a conference now in May that Systembolaget is running, and I'm going there to talk about this type of work. And also the Cancer Society continues to plan for more activities here, like spin-offs. But so far, from the PrEvCan perspective, it was to, open the can of worm to sort of do the survey among the general public. And I think that was quite clever, because it's not us saying this is how it is. It's the general people that answer the questions. And we really see that concept works. So we're planning to do a similar work on cancer and diet in the fall, to sort of do the same time or concept and see what just people know about what they eat impacts cancer. So we're seeing that we can really develop that kind of that way of communicating. And we also have to say are surprised by the attention from national media. I didn't think this would be a hot topic when, you know, the world looks like it does, but it's really been extensive media coverage, and which we need if we should make it, you know, if it should reach out to the general public. It doesn't really matter what I do on Twitter or anyone else. It needs to come out outside our sort of organizations, which I think we have managed to do with this work.
Just to finish off, going back and thinking back of the European level, the European Commission has set out a plan to introduce warning labels on alcohol and cancer, and Ireland is doing the first steps, and but there are many countries who are opposing, and of course the alcohol industry is opposing. How do you see the whole situation? I mean, European Union is big and diverse. How can we manage with this?
I think we should push it through, and I think I mean, how can you sell this product that are so risky without the warning when you do it on absolutely everything else? It's like tobacco. We had the same kind of discussion but many years ago about tobacco. Now we know so much more about the risks with alcohol, so I think it's I definitely think the EU should push through warning labels and sort of push back the resistance from alcohol lobby industry. That's really horrific if you ask me, because I think we should do that. Then of course it won't be the only thing that helps. You need to work on this with different actions, but definitely. I mean, think about everything you buy. It has to be written on the back what it contains and risks and everything, but not alcohol. It's so strange. So I think but we need the power from EU to push it through, I think, because otherwise we will have a couple of countries that do it, but not really. We will not really impact it at large scale.
Thank you, Lena, very much, and I wish all the best for the very important work that you are doing, both in Sweden and in Europe.
Thank you so much. Thank you.